this is Aaron George, and I'm reflecting upon the experience of building a family medicine residency from scratch in rural Western Maryland at Meredith Health. And I'm here with Larry Dower, who asked me to share my own training experience and how that pathway contributed towards success in residency building thus far. And some of the things that I identified first was the powerful tool of observation. So moving through my training and working with others, observing what worked well, what didn't work, and then purposely thinking about how others and institutions did things and how they could be adapted to the unique environment that I was in. So in this setting, how previous residency training and how my medical education could successfully be adapted, what worked, what didn't work, and thinking about that from an observational standpoint. The second thing was certainly, perhaps the most important, was networks and connections. And I was really fortunate in medical school and residency to seek to connect with as many different individuals as I could. And by virtue of family medicine being the friendly and family nature that it has, so many are interested to share what they've done, to seek out mentees. And I think I was very fortunate to connect with individuals with that shared passion of education and shared interest in family medicine. And when it came time to start building a residency program, rather than try to build it by myself, asking others for help. And I found that the world of family medicine is very supportive of those sort of connections and very nourishing. And so rather than trying to do it all alone, I think that I've benefited from those relationships. I can say unabashedly that without the FMEC, we would not be a residency program right now. We certainly wouldn't have been as successful a program as we are, because it gave us a natural connection, natural relationships, natural mentorship and guidance, and then marketing and support. So I think that there's an easy plug for FMEC in the work that we've done. And then I think the third thing that I would suggest from my residency training and medical school was just maintaining a state of inquiry and an openness. So leading whenever a door opened or a challenge was posed, leading with an openness and leading with yes, even without necessarily feeling the necessity to commit or overcommit. And I think that having a sense of inquiry created a lot of possibility and opportunity that otherwise would have been impossible in starting a residency program if I didn't find ways to kind of lead with yes and lead with an open air for the work that we've done. So I think that reflecting back on just what got me to a place of feeling prepared to be successful in residency were those in residency designing were those three things. I'm very fortunate to have been raised about 20 miles north of the area where our residency was founded. And so I think it is almost essential, if you're starting a new residency program, to try to make it local, to try to find faculty members, and even if it's not faculty members, find friends and champions and partners and cheerleaders that are from the area, because you're going to want to adapt it and make it local. And so it actually helped us with our own work by virtue of the fact that I knew the area, I knew the community, I knew the people. And so I think if one were to be starting a new residency program, to try to do it alone, to show up and not understand the local context, would really create a much more challenging environment to do that. And so that felt really natural to me. I think another element of success is tethering the success and energy of the program to things that the community and the health system value, and finding ways to align the needs of the community and the interests of the health system with things that are intertwined with success of the residency in a whole, has helped us to be a bit more effective. So, for example, just to comment on a couple of those things, tethering not to finances, but tethering it to primary care pipeline. and that success in the residency is less about revenue generation and more about creating good family doctors. Tethering it to community involvement and investment in local community groups, tethering it to energy and momentum for forward thinking and innovative opportunities in the community. And I think that I have found, rather than predicating the success on a new program on the residents' clinical knowledge or the number of patients that they see or the number of RVUs they generate, I've certainly found that tying the success of the program with community interests and systems interests means that it's really tough to lose.
That's a good point.
I think setting realistic expectations and then being willing to hustle to exceed them was very important, because again, it created a perception that a group of people that understand the normal timeline for creating a residency, and traditionally you're talking, $4 to $5 million and 4 to 5 years, and just setting a realistic expectation and then hustling really hard to exceed it created an energy and an engagement from the system. And that takes the personal and a team output, but it's helped us to find a lot more success in the early couple of years. Again, as opposed to being perceived as a project that's just kind of like limping along, being perceived as something that is outpacing expectations was really important. But you need a system that buys in. You need a system that's willing to invest. You need leadership that feel engaged, and you need the resources behind you. So not every system is willing to do that. So painting that value proposition early to the system is really important. And then getting key stakeholders in the community engaged and energized around the goal is also important. So for us, we early on, we partnered with the hospital foundation. We got involved with the local community health department. We went to community-centered events instead of showings and booths, and we started speaking at churches. And so what that did was it created a presence that was bigger than a clinic and generated energy that it was more than just about having more office visits for the system. So I think that those were keys to success for us in this early part of the first couple of years. I think the beauty of having something new is it allows you to be forward thinking. And so if looking to design a new residency program, it allows you to envision the future of family medicine as opposed to the current state of family medicine. And I think that's a unique opportunity because academics itself tends to become a bit layered, and it's challenging from an academic model to break layers down and start over again, or to deconstruct curricula, or to change habits. And so I think there's value in seeking to create a residency program that is forward thinking, and that also led to some buy-in from the health system when they saw the opportunity for innovation. I can't underplay. Okay, go ahead.
I was going to ask you, could you say a little bit more about focusing on the future of family medicine and not family medicine as it is now? Could you just talk about that a little bit?
Absolutely. I think that family medicine as a discipline does have the opportunity to meet the needs of what a community requires. And so that's going to be different in every community. But I do think that family medicine as a discipline, and particularly in light of the current circumstances that we have in the world, is positioned well to adapt and to respond with telemedicine, to decrease need to see multiple specialists, to implement point of care ultrasound, to utilize EMR for patient messaging and secure chat lines and things, and then to build that in a way that it becomes implicit within the work we do as opposed to added on top of the work that we do. And I still think that the medical community as a whole is struggling with trying to add all of those things on top of what we do, almost like it's something extra. And I think family medicine as a specialty has to just make it a part of who we are and what we do, so that it becomes a part of our day. And so I think, you're in building a new residency program, you have the flexibility to say, you know what, we're just going to do telemedicine visits scheduled as if it were an acute visit. We're just going to start doing them. And we don't need to go back to the drawing board with RVUs. We'll just start doing it. Team-based huddles, so you don't need to say, well, we've got to stop having patient visits at 8 o'clock. You just say every day at 8 we're gonna have huddles, and that's just how it that's the matter of fact for the practice that we have. And so I do think that there's a positive paradigm to starting a family medicine residency, so you get to build the playbook from scratch and adapt it to your community. And there's something that's energizing about that if you do it right.
That's great. What do you think have been, so here you are coming out of Summit, you're coming into a residency program, and think about it for the moment at a kind of a personal level. What did this opportunity mean to you?
Well, I think in the first place, it gives
Aaron, you're breaking up. You're breaking up.
No, I was thinking.
Oh, okay. All right.
I was here.
I can't tell if you're thinking or you're talking. It's just only every third or fourth word's coming through. Now nothing is coming through. Hello?
Hey, Larry. Hey, Larry.
There you are.
Hey, maybe I am. I'm out. I'm out dropping off something at one of the practices here, and I am a little bit more in the country than I expected. I wonder, would you be free for a little bit if I could call you back in a bit?
Yeah.
I'm just in less cell coverage than I thought I'd have here. So could I try to drop this off real quick and then maybe give you a call back in 10 or so?
Yeah, just text me a message and I'll jump back on the platform I'm using.
Okay. Do you have a couple of moments? I don't want to dive into your schedule any crazier. I can get that in.
Yeah, I'm okay.
Okay, perfect. I'll call you. I'm hoping about 10 or so.
Okay.
Thanks, Larry.
Bye-bye.